Do you remember a story that we shared together in the Dominican Republic in a batey, a sugarcane batey, where there were a lot of Haitian migrant workers basically living in indentured servitude for the rest of their lives, cutting sugarcane? Do you remember the Haitian man that we encountered who got kind of stuck because he had had a suprapubic tube put into his bladder? Probably he had a large prostate and couldn't pee, so they put a tube in his bladder, but nobody explained to him what it was. Do you remember that guy?
I mean, I remember, you actually came on to the bus that all of the students were on, and you put it to us and gave us the option. Hey, what do you think? Do you think that we should actually support this person with everyone donating a couple of dollars in order to try to help him get back to his family? And we had a real discussion around the ethics of the justice of helping this one man with kind of a medically non-related issue. And I think we came to the conclusion that yes, we all wanted to pitch in and try to help raise the money in order to get him back toward the community that could take best care of him. What I took from that was actually the level of real thought into those kind of decisions, and what are the potential secondary consequences, what are the unintended outcomes of this, and just having more of a profound appreciation that all of our actions and interventions as healthcare practitioners, there's ripples there.
I loved that story so much because I remember when we all decided, it was rather spontaneous. There wasn't much debate. Everybody in the bus said, well, of course. If it's just a few dollars, we can easily take up a collection to send this man back to Haiti. And I argued then and I'd argue now that it wasn't medically unrelated, actually. But then the minute we decided to take up this little collection, immediately the skies clouded over. We had the most thunderous rainstorm. And it was perfect because we were actually able to kind of sneak into that guy's cabin without the entire community noticing that he was getting specially singled out, which of course was one of our concerns. What happens if everybody else in the community sees that we're singling him out? And so it was kind of like nature and the universe colluded with us. That's the sort of opportunity that I live for in my teaching, because you couldn't invent that story. You couldn't make it up. It was real. That's one of the things that I just love about the kind of teaching that our center can make possible.
So I guess that brings up a question I'm interested in. At this point, you've had 15 years at the head of the CMHE. How do you think all of those teaching moments stack up to affect the culture of the UT San Antonio, or just medicine more generally with the students that have come through the CMHE?
I think our presence is we're like flag bearers, a reminder of the importance of being a voice for compassion in medicine, a reminder of the connection between empathy and ethics, the contribution of this type of experiential learning in global health, in community service learning, in the student-run free clinics, is that it shapes people into a certain kind of physician. You have a certain set of lenses through which you look at your patient population and through which you reflect on yourself. I believe that people who participate in our opportunities have their empathy preserved, like you, have tremendous positive reinforcement about developing their communication skills so they could be really good listeners and good communicators. And they're community-connected, community-minded people, just like you. One of the things that you worked hardest on during your time here, and we worked together on this very hard, was establishing the Pride Clinic, which is an LGBTQ-focused free clinic for folks who either can't get care elsewhere or they're uninsured. What did it mean to you to participate in that?
From a personal standpoint, it's a community that I count myself a part of, and I'm passionate about encouraging equity within healthcare for the LGBT community, because unfortunately there are still some significant inequities. From a professional standpoint, I think that it was a really incredible experience to try to, over the course of the 4 years in medical school, really define a community need by listening to, speaking to members of that community, and repackage that in a way that is convincing to an institution that this is something we can and should be doing, and then build a program to address the gaps that are there. Being able to organize resources to put together a response and to actually implement it and see the impact almost immediately on patient lives and on the students and the faculty who worked in clinic and had the opportunities to learn and to do there was huge.
You went to the Dominican Republic, you went to Mozambique, you helped found the Pride Clinic.
I took part in our ethics journal club as well.
Wrote a prize-winning ethics essay on CRISPR-Cas9, I remember.
I think that probably what was kind of most fun with it was that even in the midst of kind of doing hard work like that, the enjoyment of it, the energy of actually making an impact just lightened things so much for the medical students and the faculty. And I remember those environments in the student-run free clinics being just filled with camaraderie and appreciation and joy. And sometimes we lose track of joy in medicine.
Well, we certainly had fun while you were here, that's for sure.
Well, I've got to hear some sort of big reflection, though, on 20 years of the CMHE. What does that mean to you? And what do you think your lasting impact might be?
Well, I think our center is pretty unique in that we have these 4-pillar programs that you know so well: global health and service learning that you participated in robustly, but also ethics and professionalism education, which we do through didactics and discussions, and then medical humanities. What's unique is that we have these 4 really strong programs all under one roof. And they may seem disparate, and yet they really are of a piece. And they're all part of our mission to teach ethics and professionalism to medical students and health professionals while nurturing empathy and humanitarian values. And you remember our vision statement, of course, preparing tomorrow's healers to act with compassion and justice. And I think that what we've uniquely done is shown how these 4 different modalities can be woven together into a whole that's truly enriching and can truly nurture people and shape the orientation that they take forward as professionals.
Well, I'm thankful that I had the opportunity to partake and that it was part of my medical training. I think that it has played an outside role in both the doctor that I want to be and the doctor that I'm becoming.